Hello, my name is Rose Mitchell, and I have chosen food insecurity as social determinant of mental health in Salem, Marion County, Oregon. Food insecurity is defined as limited availability of nutritionally adequate food or uncertain ability to acquire nutritionally adequate food in socially acceptable way. Here is the food insecurity statistics comparing Marion County, the state of Oregon, and the United States. In many categories, Marion County food insecurity has higher percentage than the state of Oregon or nationwide. For example, the child food insecurity is rated at 19.4 in Marion County, whereas it's 18.9% in Oregon and even lower in America at 16.6%. Also, the rate of food insecurity among Native American, which is 31%, and Black American at 28.1%, and Hispanic at 28.8%, much higher than in Oregon and nationwide. So you can see it is obvious that food insecurity is a huge problem in Marion County. So how does food insecurity interact with other social determinants of mental health? Well, food insecurity has been linked with unemployment, income, disability, and poverty, which are also important social determinants for mental health. The risk of food insecurity increases when money to buy food is limited. High unemployment rate among low-income population make it difficult to meet basic household food needs. Children with unemployed parents also have higher rates of food insecurity than children with employed parents. Disabled adults may have higher risk for food insecurity due to limited opportunities and healthcare-related expenses that reduce the income and available to buy food. Racial and ethnic disparities exist related to food insecurity, which is higher among Black American compared to white and Asian American. Mental health disorders are associated with food insecurity. There are many mental health disorders and psychological distress associated with food insecurity, like depression, anxiety, ADHD, suicide ideation, stress. It also affects cognitive abilities, mood, and attention span. Children who are hungry have more difficulty learning in school. Research have shown associations with food insecurity with chronic diseases such as diabetes, heart disease, high blood pressure, high cholesterol level, and obesity. In addition, children with food insecurity are at risk for developing behavioral problems like hyperactivity, anxiety, and aggression. They are also at an increased risk for a variety of negative health outcomes. Some intervention to reduce food insecurity among children and to reduce the disparities of food insecurity among ethnic groups are through food assistance programs such as Supplemental Nutrition Assistance Program, SNAP, the Women, Infant, and Children, the WIC program, National School Lunch Program, and SLP. Studies have shown that these programs have helped reduce food insecurity. In 2021, Marion Polk, a food share network, provided more than 11 million pounds of nutritious food to people in need across the Mid-Valley. They work to eliminate the causes of hunger through vocational training, nutrition education, garden educations, and by working with communities to strengthen local food system. Other intervention is to connect children and families to major federal nutrition program that benefit children and families like SNAP, WIC, NSLP, and school breakfast program, summer nutritious program, as well as after-school nutrition programs. We also want to improve the adequacy of monthly SNAP program benefit. Right now, the SNAP benefit are not enough to get through the entire month, without hunger or being forced to sacrifice nutrition quality. We also want to oppose rollback on policies that allow state to get SNAP benefit from people in need. A number of harmful proposals have been issued in recent years that would reduce or eliminate SNAP benefit for certain individuals and households, including those who are unemployed, underemployed, or earning their way up the economic ladders. This is not good, so we want to oppose it. More interventions here. We also want to improve child nutrition program access and participations by underserved children in communities. Too many children, especially from low-income households, are missing out on the nutritional and health benefit from participating in WIC and other federal food programs in the school. We want to ensure nutrition quality in child nutrition program through science-based standard. Despite widespread support, efforts have been underway to roll back the science-based school meal nutrition standard issued in January 2012. If unsuccessful, the end result will be weakening of the standard for whole grain, sodium milk fruits, and vegetables. This would be inconsistent with the recommendations of the Dietary Guideline for American, which recommends serving whole grain food, fruits, and vegetables and limiting sodium and saturated fats. Other intervention is leveraging the local and federal policies targeting food insecurity, for example, retail store intervention where healthy food placement, promotion, and price influence healthier choices, increase sweetened beverage and junk food taxes, and remove taxes on water and fruit and vegetables. And last intervention is improving transportation across access in low-income neighborhood to allow access to full-service supermarkets or grocery stores. Residents are at risk for food insecurity in neighborhood where transportation options are limited. The travel distance to store is greater and there are fewer supermarkets. So actions that I would take to address health disparities due to food insecurity in my future practice would be I would screen for food insecurity in healthcare setting, connect children and their families to benefit in the federal nutrition programs. I would also actively advocate for policies to alleviate food insecurity and its root causes. I will do my part as provider to protect immigrant families from policies that may threaten their health, nutrition, and well-being. As a mental health provider, I would provide them with up-to-date information about their eligibility for program benefit as well as what benefit do not count against immigration status. And then on a personal individual level, I would donate non-perishable food, healthy food like proteins and whole grain to food pantries. Families experiencing food insecurity rely on donated food at food pantries to help them stretch their budget. That concludes my presentations. Here are my references. Thank you for listening.